Good evening to everyone and welcome to an evening with 20,000 bullets for NEETPG in 10,000 minutes in the next 90 days. We invite Surya, Surya Prabha, Rahman, Akash Rai, Manoj Thakur, Dheeraj Krishna, Rakesh and many more. The future toppers in another couple of months in the NEETPG. As Dr. Murali Bharadwaj, my job is to inspire you in the next couple of hours, to recharge yourself, to be re-inclined to finish some of the high yield points for the NEETPG. What is the tough thing in preparation for NEETPG exam? Microbiology is the driest subject on this planet. We feel like a sort of an involutional depression to read two subjects, microbiology and SPM, called sleep promoting medicine. But let me tell you, can you please punch whether the voice is loud and clear? Kunjit, Keshav, Kushbu and many more. Can you please punch whether the voice is loud and clear for all of you? Yeah. So, gram-positive organisms, gram-negative organisms, how do we classify? What is the differentiating feature among them? 3 to 4 classical bullets about each of these organisms. If you can be able to master in the next 1 hour, that is the best help I would have done to all of you. Now, how do you look at gram-positive bacteria? Bacilli, cocci and branching filaments, that's how we divide them. Bacilli can be aerobic or anaerobic. Give me one gram-positive anaerobic bacillus, classical example, Clostridium. Whereas Listeria, Corynebacterium, Bacillus, they are all called aerobic bacilli. Please don't forget, gram-positive bacilli. Then, if you look at the branching filaments, once more they are divided into aerobic and anaerobic, which you have to be very clear. Which is the aerobic branching filament which is gram-positive? Nocardia. The moment examiner asks you gram-positive branching filament aerobic, reflexly you should answer it as nocardia. And nocardia is weakly acid fast. One more special point about it. Whereas, if you look at anaerobic branching filament which is gram-positive, please don't forget actinomyces. Until this, the story is very easy. The whole challenge is, which is aerobic cocci among the gram-positive bacteria and how to differentiate between them is all the secret of microbiology. If you know this table, you have to mug this table. It is available in every book, every entrance review, available in Google, everywhere you go. It is nothing coming up new. But how this table can sit into our brain when we are going for the NEETPG, that is the differentiator between winner and loser of the microbiology part of the game of NEETPG. Gram-positive cocci among the aerobic, you divide them whether they are catalase positive or catalase negative. Based on that, you will decide whether it is Staphylococcus or Streptococcus. Among Streptococci, once more, you divide them into alpha hemolytic, which is partial hemolysis, beta hemolysis, which is complete hemolysis, gamma hemolysis, which is non-hemolytic. Then among the alpha hemolytic, you will look whether it is octochin sensitive or not. Suppose if it is optochin sensitive, then typically the best example of a optochin sensitive, gram positive, aerobic, alpha hemolytic streptococci is the streptococci pneumonia. That should come to your mind. And what is the one which is not optochin sensitive? The viridans group streptococci, Streptococcus viridans, is typically not optochin sensitive. That is what you have to basically remember. Then among the beta hemolytic, that is a complete hemolysis showing gram positive cocci, you should look whether they are bacitracin sensitive or not. That is the differentiator among the beta hemolytic streptococci. The one which is bacitracin sensitive is the one which is Streptococcus pyogenes, the one which is called group A. Then that's the reason rheumatic fever is caused by which organism? We say group A beta hemolytic streptococci. That means who is that group A? Sorry, which one is called as group A beta hemolytic streptococci? Streptococcus pyogenes. Then among the beta hemolytic, which is completely hemolyzing, which is not bacitracin sensitive, don't forget, it is the group B, which is also called Streptococcus agalactiaceae, is the one which you have to basically remember. Then gamma hemolytic, how to differentiate among within the gamma hemolytic? You will look whether can it grow in the sea water, 6% NaCl, can it grow or it cannot grow? That is the differentiator. So if it can be able to grow in the sea water, salt water, then that is the group D, which is also called Enterococci. Whereas if it cannot grow, then typically it is Streptococcus bovis like organism, which is called non-enterococci. Whether enterococci or non-enterococci, they are fundamentally not hemolytic, that is they are gamma hemolytic. This is a simple table, doctor, especially Streptococcus ka beta or paute, children, grandchildren ko samajhne, you should remember. So how will you remember? Once more, alpha hemolytic you will differentiate with optochin sensitivity. Alpha, optochin, both are no, easy to remember. Then beta hemolytic is differentiated by bacitracin sensitivity. B is bacitracin, B is beta hemolytic, that will differentiate the beta hemolytic organisms. Then gamma hemolytic is differentiated by the growth, whether they can grow in salt or not. So this is the fundamental point. If you know that, you know entire at least gram positive world, you are the uncrowned king. That's what you can remember. Then if you look at Staphylococci, you will look whether they are coagulase positive or coagulase negative. Based upon that, you will be knowing whether it is a Staphylococcus aureus, which is positive, or if it is not positive, then you look whether it is novobiosine sensitive or not. Novobiosine sensitivity, if it is there, then it is Staphylococcus epidermidis. And if it is not sensitive, then it is Staphylococcus saprophyticus. So this is one table, doctor. I am telling you, you just open Google. In the images, you ask for Streptococci, the gram positive bacteria classification. There are so many ways of classifying and trying to remember, but I found this is the easiest way of classifying. Come on, summarize. How do you differentiate alpha hemolytic organisms? Optochin sensitivity. Is what you need to remember. Beta hemolytic, bacitracin sensitivity differentiates. Gamma hemolytic, the differentiator is 6% NaCl. Can it grow or not? Then among Staphylococci, it is a novobiosine sensitivity that differentiates between epidermidis, which is sensitive, and the saprophyticus, which is not sensitive. So this is a very important thing. Now let us quickly go to each of the organism. Rakesh is asking, can you please zoom in the text? That figure which I have shown you is available in Google everywhere in the planet Earth. So don't worry. But even without the table before you, you should close the eyes and remember. I am telling you. Alpha hemolytic, octogen sensitivity differentiator. Beta hemolytic, bezetacin sensitivity. Gamma hemolytic, NaCl, 6% NaCl, whether it can grow or not. Then among catalase negative staphylococci, novobiosine sensitivity is the differentiator. That's all. Everything else you will remember, but just until next 2-3 months you have to remember. See, to get seat into MBBS, we studied a lot of useless things. What is Solanaceae, what is Liliaceae, what is Brassicaceae, what is botanical names, blah, 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 blah. Oh my God. And we have done simple harmonic motion, so much of physics. Is it of any use for us after joining medical college? Not at all. So unfortunately, in our education system, filtering is done on certain useless criteria, unfortunately. You go and ask a gastroenterologist what is novobiosine sensitivity. He will remember Novartis. He won't remember novobiosine. So doctor, for the next 90 days, there is some useless stuff. Big, useless piece of shit we need to remember. Develop methods of remembering it and reproduce an exam. All the toppers pass to the same phase, no regrets about it. Start enjoying how to get into this game of consolidation of preparation in the last 90 days. Now, gram-positive cocci. Let us talk Enterococcus. Enterococcus is nitrite negative. That's the first word you need to remember. Enter, oh, that is nothing can enter. So that means nitrate is negative. N for nitrite is negative. So Enterococcus has got fecalis, faecium. Where is it important? Enterococcus lead to infective endocarditis, especially if you are having any genitourinary intervention or what is a genitourinary intervention? Suppose you happen to have anything, a surgical procedure entering into your genital tract or a GI problem, then it typically lead to development of infective endocarditis by entering into the bloodstream. It is also responsible for the urinary tract infections also. But Enterococcus, what is the important drug of choice you will remember? Vancomycin, you should not forget. So this is how the Enterococci typically looks like. And they are also earlier called group D Streptococci. But there are some special features for this group D Streptococci which are Enterococci. They have an ability to grow in 6.5% NaCl. Now tell me, 6.5% NaCl, where did we just before studied? Gamma hemolytic streptococci. To differentiate within the gamma hemolytic streptococci, we used 6.5% NaCl. The ones which grow in that 6.5% NaCl and which are gamma hemolytic are classically the Enterococci. They can hydrolyze the esculin in 40% bile and they can be able to grow at 10 degrees Celsius and 45 degrees Celsius, but they are all not important. Only you need to remember 6.5% NaCl growth means what will you remember? You will remember Enterococci is what I want to underscore to all of you. Very good. This is called nitrate reduction. What did I tell you about Enterococci? Immediately what you should remember? Entero. Nothing can enter. Nitrate is negative. So we use a nitrate reduction test. What is the importance of nitrate reduction? This is called peptone nitrate broth. Suppose if the nitrate reduction is, if the organism is capable, then you get a color like this change. E. coli, they also stay in the gut. E. coli are the classical example of the organisms that are the ones which show nitrate reduction positivity. Whereas Enterococci, though they are also there in the gut, they are not nitrate reducing is what you have to basically remember. Now few bullets about Staphylococcus. I am very happy to see 131 students being online. Please tell your classmates it is an absolutely free session for the next 90 days and a couple of hours. It's called Chai Pe Charcha is what especially 6 to 8 is a time where our adrenal is very low. We don't feel like reading in the reading room. So that is the best time that you get a classmate like Dr. Murali Bharadwaj to chat a little bit, to get challenged a little bit. So after we finish gram positive, gram negative cocci today, we'll have the quiz. Quiz is the one which received a very good response. Yesterday, a lot of students wrote a very good feedback, WhatsApping that, so the quiz is a good feature. Probably more quiz and less of the review is opinion of the students. So, Staph aureus, gram positive cocci which are in clusters is the classical appearance. It is coagulase positive and also catalase positive. And what is that organism? Both positive. That is Staphylococcus aureus. And now remaining things are all very easy. It leads to cellulitis, paniculitis, mastitis, balanitis, carbuncle, furuncle, anything, folliculitis, fasciitis, all soft tissue infections. Just think of Staphylococcus aureus should be your answer. Similarly, paronychia, osteomyelitis. Most common cause of the osteomyelitis will be the Staphylococcus except in sickle cell anemia patients where Salmonella is very common. Now what are the toxins that are produced by the Staphylococcus? It produces enterotoxins. And if you look at the food poisoning caused by the Staphylococcus, there is a preformed toxin which is involved. That's the reason its half-life is very short. Within 6 hours after consuming food, people start developing vomiting and everything. There is a favorite question of the examiner. Less than 8 hours, symptoms developed in food poisoning. What is the organism responsible? What comes to your mind? Staphylococcus aureus. It produces elastase, collagenase, lecithinase, lipase, penicillinase, coagulase, blah blah blah. But what is important bullet you need to remember? Whenever we get common cold, influenza, post-influenza, some people go into pneumonia. Most common organism, bacterial organism implicated in the post-influenza pneumonia, you should remember Staphylococcus aureus is I want to underscore. So this is how you find a carbuncle classically. This is how on the forehead you can see the presence of a furuncle. Once more, what is the organism that comes to your mind? Furuncle, carbuncle, Staphylococcus. The next organism is Staphylococcus epidermidis. It is also gram-positive cluster under the epidermis. But what is the differentiator between the Staphylococcus aureus versus the Staphylococcus epidermidis? Both of them are coagulase positive, but this is catalase negative. And if you look at the novobiocin sensitivity, that is another important feature of the Staphylococcus epidermidis is what I want to underscore to all of you. Epidermidis can cause vegetations on the tricuspid. Those who are IV drug abusers, from the epidermis it will go and lead to right-sided circulation will go towards the right atrioventricular valve, which is the tricuspid. So central lines, ventriculoperitoneal shunts between the brain and the peritoneum, they are all the important things implicated in breeding the Staphylococcus epidermidis. So how do you treat? Vancomycin is the drug of choice for the Staphylococcus epidermidis, and if it is vancomycin resistant, then linezolid is the one which you will be using. So don't forget, linezolid for the vancomycin resistant Staphylococcus epidermidis is the NEETPG bullet that you are going to remember, and fire it in tomorrow's exam and you will remember me. Now let us talk on novobiocin sensitivity. If you want to differentiate saprophyticus Staphylococcal from that of the Staphylococcus epidermidis and aureus on one hand and saprophyticus on other hand, what is the differentiator? Saprophyticus is novobiocin resistant, whereas epidermidis and aureus, both of them are novobiocin sensitive. Once more, between epidermidis and aureus, how do you differentiate? Epidermidis is catalase negative, coagulase positive, and based upon this, we can differentiate epidermidis from that of the aureus, as what we have already discussed in that master table, right? So don't forget that. So let us quickly summarize these three organisms, doctor. Yeah. Rakesh is saying, I have not found such a live lecture, that too for free with best interaction anywhere. Super compliment. Knowledge is supposed to be free only once upon a time. I still remember in 1999, PGA जाओ clean bold. एम्स जाके एंट्रेंस लिख रहे थे हम, थे clean bold. Not even qualified in JIPMER. Life was miserable. Then I started coaching classes in a small school. The school principal's son was taking coaching. So it was a free classroom. And me also preparing for entrance exam. So teaching is a way by which I also get a refinement in my preparation. I used to have about 200 students from Usmania, Gandhi Medical College and Deccan Medical College in Hyderabad, sitting early morning at around 5 o'clock before the school children come at 7:30, we used to have a class. I used to never ask any fee. So the session was very popular, it was all going on well. Suddenly one day, the school owner came and said, every day I am seeing 200 students and now bloody you have to pay me the fee. Then I thought, please give another 2 more months of time, I'll vacate this place. No way, from tomorrow no classes if you don't pay me the rent. Immediately, the first 3 rows, there are about 20 students among the girls who are sitting. They plugged out each 2000 rupees and then gave. Then I said, I never asked you to the fee, but today you are paying. Sir, we are bringing the fee every day. Only you are not asking, we are not paying. So, what I am telling you is, tomorrow after you finish your entrance, you will become MD. After you become MD, you will start practice. All your focus in the first or any point of time of your practice is, how best I can offer a service. You don't want also money will fall for you. You don't need to propaganda, don't need to do anything. Your focus should be on, can I handle this diabetic ketoacidosis which was mismanaged by somebody else? Can I be able to deliver this obstructed labor which the other person has mismanaged? Can I be able to manage this electrolyte dysfunction which was not handled properly by somebody else? Can I be able to do that? The moment you are doing, you are saving people, you are helping them out, the whole world will be behind you. Take it as my word. So, generally, most of the times, knowledge and I mean the education and the treating people. In these two, if you are contented with what you have done today, the work, and treated the people or taught the people, the wealth will automatically follow you. So that's what I like to re-emphasize to all of you. So gram-positive cocci or Staph aureus. One question invariably comes on this topic, doctor. It is mannitol fermentation, DNA is positive, novobiosine sensitive, coagulase positive, catalase positive. Whereas saprophyticus is also gram-positive cocci in clumps, but it cannot ferment the mannitol. One of the favorite question of the examiner. It is DNase negative unlike Staph aureus, and it is novobiosine resistant unlike Staph aureus, which is sensitive. It is coagulase negative unlike Staph aureus, which is positive. That is the differentiator. Then Staph aureus and saprophyticus in one hand versus epidermidase, how do you differentiate? You basically differentiate by novobiosine sensitivity, which is the feature of the epidermidase, is what you have to basically remember. Now, doctor, let's go to the next question. What is the name of this test? Novobiosine sensitivity. If it is sensitive, it is Staph epidermidis like this. If it is resistant, it is Staph saprophyticus like this. So this is how you basically differentiate. Now let us look at the various pigments which are formed by the bacteria. One of the most important question you should remember, frequently asked. Pseudomonas produce golden green, aureus produce gold, epidermidis is white, and saprophyticus does not produce any pigment, which is a differentiator. Then if you look at the bacterial endocarditis, if it is the acute endocarditis, it is a Staph aureus. Subacute, Streptococcus viridans. And most important thing to remember is, whenever you are treating a subacute viridans streptococci, neficillin plus gentamicin, only giving a cell wall synthesis inhibitor like penicillin will not be sufficient. You have to add aminoglycoside when you are treating the viridans. One of the favorite questions of the examiner, neficillin plus gentamicin for 4 weeks is the treatment in case of the Streptococcus viridans is what need to be remembered. So this is how the neficillin basically looks like. Now let us talk about saprophyticus. What is the story of saprophyticus? Already we discussed, it is both coagulase negative and novobiosine resistant. That's the reason you need to remember. It's very common after the honeymoon, when madam comes home, she has got burning micturition, retention of urine or increased frequency. It's called honeymoon cystitis. Classical example is Staph saprophyticus is the underlying cause, is what need to be remembered. Now doctor, this is one favorite question which you have to basically remember. Diplococci. In this, you have gram-negative organism which can be diplococci or gram-positive which can be diplococci. Diplococci means two cocci kissing each other is the diplococci. Neisseria gonorrhea is the gram-negative diplococci. Streptococcus pneumoniae is the gram-positive diplococci. These are the two important buzzwords which you should not forget in the tomorrow's exam. Now let us talk about Streptococcus agalactiae. Pediatric meningitis, it is one of the common organisms, group B streptococci. It also leads to pharyngitis, anterior cervical lymphadenopathy. But what are the two NEETPG bullets that you should remember when it comes to group B streptococci? Number one, Christie-Atkinson-Munch-Peterson test, CAMP test, it is called as Christie-Atkinson-Munch-Peterson, right? So, CAMP test and rapid hip rate hydrolysis. These two bullets for NEETPG for group B streptococci, if you remember doctor, You will definitely remember me in the tomorrow's exam. Examiner will ask you, CAM test is important for which gram-positive organism? You will immediately answer it as group B streptococci. I will tell you what is CAM test and rapid hip rate quickly. But how do you treat group B? We give penicillin G 1.2 million units. IM is considered the management of choice, treatment of choice. Now, what is the importance of CAMP reaction? Suppose if you want to differentiate Streptococci agalactiaceae from that of other organisms, CAMP test will help you. So, what is this basically? There is a beta lysine which is produced by the hemolytic Staphylococcus aureus, beta hemolytic Staphylococcus aureus. Then it will act synergistically with what is called as CAMP factor, which is being produced by both the beta hemolytic and non-hemolytic, that is gamma hemolytic Streptococcus agalactiaceae, that is a group B. And because of this beta lysine of the Staph aureus and the CAM factor produced by the Streptococcus agalactiaceae together, there is a synergistic reaction with an increased visible zone of hemolysis that will be found in the culture. So, this kind of a CAMP reaction is a feature only very much unique for the Streptococcus agalactiaceae, which is a group B organism, is what you have to basically remember. Whereas the group A or group C or the group G Streptococcus does not show the CAMP reaction positivity. So, what is the buzzwords? 2 bullets you will remember about group B Streptococci, doctor. CAMP test positivity, rapid hip rate hydrolysis. These are the 2 things please don't forget when it comes to Streptococcus agalactiaceae, is what I want to underscore to all of you. So, this is how the Streptococcus agalactiaceae typically look like, group B Streptococci. Now, let us talk about Streptococcus pneumoniae. Streptococcus pneumoniae is also called pneumococcus. If at all there is only gram-positive diplococci, which one it is, doctor? You should remember Streptococcus pneumoniae. If I ask you a question, most common cause of sinusitis, most common cause of otitis, most common cause of bronchitis, most common cause of pneumonia, that most common for all these upper respiratory and lower respiratory infections, you should remember Streptococcus pneumoniae. What are the 2 bullets about it? It has got a capsule, it is IgA protease positive, and it can lead to otitis media, and we give pneumococcal vaccine to certain population. Who are those special population? Sickle cell patients who are less than 2, who are around 2 years of age, and the people who have more than 65 years of age, those who have end organ failure, those who are splenic, etc., etc. So, when it comes to Streptococcus pneumoniae, the special feature which you should not forget is the thick capsule. Please don't forget it. IgA protease positivity is the important feature. So, what is that gram-positive organism which has got a capsule? Streptococcus pneumoniae is what you are going to remember. Now, let us talk about Streptococcus pyogenes, which is a group A streptococci. What are the classical infections that you should remember synonymous with Streptococcus pyogenes? Lymphangitis, impetigo, necrotizing fasciitis. They are all the things. Immediately your answer should be Streptococcus pyogenes. And we use the topical mupirocin, favorite ointment for all the dermatologists. Mupirocin लगाओ, कभी भी कुछ भी lesion हो जाए skin के ऊपर. That is for pyogenes. Cephalexin is very useful. M protein is the virulence factor, and the capsule of the pyogenes is having the hyaluronic acid. And what is group A streptococci? It is beta hemolytic streptococci is what need to be remembered. And how do you basically treat the necrotizing fasciitis, etc.? You need to do debridement, and clindamycin is the one which is preferred. Then what is meant by erysipelas, which are caused by the streptococcus? Red, shiny, swollen, does not blanch infection of the subcutaneous fat is basically called the erysipelas. Once more, you need to remember, not staphylococcus, streptococcus pyogenes. Scarlet fever. What are the two important bullets, doctor, with regard to scarlet fever? Sandpaper rash, strawberry tongue. These are the two words you should remember. So this is the classical example of how a sandpaper rash of the scarlet fever typically looks like. But scarlet fever and all are pre-antibiotic era conditions. We are in the modern era, right, doc? But for entrance examiner, he won't change. He keeps asking historical questions. Now, Streptococcus viridans. It is also called group D. 2-3 bullets you should remember. It leads to subacute bacterial endocarditis. Suppose if the valve is normal, it won't cause endocarditis. If it is a damaged valve, which is the most common organism leading to infective endocarditis? If that is the question of the examiner, what is your answer? Streptococcus viridans, which is the group D. So already we discussed which is the gram-positive organism with capsule. Can you tell me gram-negative organisms which also have got a capsule? Very important. Salmonella, Klebsiella, Haemophilus, Pseudomonas, Listeria. These are the gram-negative organisms which have a capsule, which is very, very important and favorite MCQ of the examiner. Then one more question asked. Diarrhea occurring within a short incubation of 0 to 8 hours. Where do you see that? Favorite question of the examiner. Staph aureus, Bacillus cereus, Clostridium. Don't forget, these are the 3 organisms that have a preformed toxin. That's the reason diarrhea occurs within 0 to 8 hours is what you have to remember. Then comes the gram-positive rods. You still remember that first classification table that we discussed? That is going to be your Bible for the bacteriology, entire bacteriology, right? Now, actinomyces. You all know there is a fistula formation, sulfur granules, but favorite bullet of examiner is what is the treatment of actinomyces? We start thinking of fungal medicines. No, not antifungals. Myces, the word will mislead us. Penicillin for 12 months. Like a gun you should answer in the tomorrow's exam. This kind, there are every day around 10,000 questions are answered by the students on the quizzes. Right, doc? Our artificial intelligence is analyzing on the UMedico app the wrong answers of the students. This is the very common wrong answer. Actinomyces, people will start answering nystatin, amphotericin, blah, blah, blah. And nobody will think to answer penicillin. So that is the important thing. So sulfur granules are the ones which are produced by the actinomyces is what you are classically seeing. Then 4-5 points about Bacillus anthracis. Boxcar appearance. This is something which you should not forget. Favorite question of the examiner. They are capsulated bacilli. They are square ended like squares. Hence called boxcar appearance. Then they produce edema factor, lethal factor, blah, blah, blah. They produce a black eschar malignant pustule. But the beauty part about eschar, one of the favorite questions asked by the examiner is, will the eschar will be a spreading lesion or will it be a localized lesion? It is typically a localized lesion that doesn't spread. Whenever it is pulmonary anthrax, then it leads to necrosis of the lung, hemorrhagic pneumonitis. Patient virtually drowns into his own blood pool. Now comes the bullet. Examiner, one of the options he will ask you tomorrow. Will there be person-to-person transmission which can happen in the cutaneous anthrax? You rub the skin with another cutaneous anthrax also, person-to-person transmission doesn't occur. and treatment is ciprofloxacin, which you need to remember. So this is called the box scar. Please don't forget, doctor, when this question comes in tomorrow's exam, you will remember me. So here you can see that large box scar shaped anthrax. Then comes the Bacillus cereus. Fried rice biryani order karo. Bacillus cereus ka preformed toxin, assured food poisoning will be available, right? Then Clostridium botulinum. What are the 3-4 bullets which you should remember in the last 90 days? It is the adult canned food, which is the most common reason. Which you need to remember. Sometimes some of the students questions I may while delivering I may be missing, but other students can always answer them. I am very happy to see 165 audience across the country quickly assimilating the finest of the microbiology for the NEETPG. See, doctor, a lot of times students ask a question. I doubt whether I am perfect in the subject or not. I doubt whether I am perfect or not. You know, how will you know that you are perfect or not? Agar 10 घंटे में, if you can revise the whole subject, the day you are like that, you are ready. You are ready for any war. You are stocked with missiles and bullets. If you say, maybe 10 days I will take to finish microbiology, means you are in a very novice early stage. You are too early for this year, or rather too late for this year and too early for the next year NEETPG. So that's the reason. Quickly, if you can summarize and say that, yeah, these are the things, these are the critical areas where I can fall down. If that perfection, if you have in a subject, to consolidate it within 10 hours, that day you are going to be topper. Let me be very honest with you. So how does botulinum toxin work? Favorite question of examiner. Is it presynaptic or postsynaptic? It inhibits the release of the acetylcholine in the presynaptic area, and because of that, muscle contraction doesn't occur. At the neuromuscular junction, unless acetylcholine is released, the muscle cannot be able to contract and everything goes into paralysis and respiratory failure will occur. So how do you test botulinum? Look for the toxin in the stool is considered the investigation. Then the IV drug abusers, they also can get botulism, especially the black tar heroin, if they are administering, that is the source of botulism. Next bullet point. Is it a flaccidity or rigidity? Ascending or descending? Symmetrical or asymmetrical? What kind of paralysis you describe botulism? Flaccid, descending paralysis with a normal sensory system. If the sensory system is abnormal, it is no more botulism. Favorite question of the examiner. What happens? Will there be paresthesias? No, sir. Will there be any numbness? No, sir. Sensory, absolutely normal. Descending, flaccid, paralysis is the description of botulinum. How do you treat? You give antitoxin, penicillin with intubation is considered to be the management of choice. So you are not going to forget canned foods and botulinum. Then botulinum toxin has got a light chain, heavy chain in the toxin A. So typically what does this do? This light chain will cause the cleavage of a protein called SNAP25 protein. If this SNAP25 is not there, then acetylcholine will not be released. If it is not released, muscle cannot be able to contract. That is how you should remember the botulinum. Invariably, 1 in the 300 questions will be, doctor, mechanism of action of one of the toxins. Shiga toxin, E. coli toxin, botulinum toxin, cholera toxin. You should be very sure how these various toxins function. So normal process SNAP25 will enable the acetylcholine release, whereas in botulinum toxin it won't let that to happen, is what you have to basically remember. Right. Then Clostridium difficile. Clostridium difficile. Shah Huzaifa asked a very good question. Why penicillin, sir, when it is a preformed toxin? Very good. I too never got this doubt. If somebody has got an answer, please punch it. Clostridium difficile. Pseudomembranous colitis, all of you know, expressive diarrhea. If you give clindamycin, you get it, especially intravenous clindamycin. And stool cytotoxin will help you to diagnose. And how do you treat difficile? You give vancomycin or metronidazole, please don't forget, is considered to be the treatment. So this is how the endoscopic picture of a Clostridium difficile typically looks like. Now comes Clostridium septicum. Clostridium septicum, those who have colon cancer, they are at the risk of developing the Clostridium septicum. But you need to remember it because it produces a black pigment. That is a characteristic feature. Melanin producing Clostridium is the Clostridium septicum novoi, is what need to be remembered. Perfringens. Perfringens is anaerobe, and if you eat a turkey, if you eat a holiday ham, they are the risk factors for perfringens. Remaining things are all easy. It can lead to wet gangrene, it can lead to dry gangrene, it can lead to gas gangrene in the case of the diabetics. But what is the toxin of the Clostridium responsible for the gas gangrene? Favorite question. Alpha toxin is what you need to remember. Then dry gangrene, how do you treat, doctor? Immediate amputation is the treatment of choice for the dry gangrene. Wet gangrene, how do you treat? So basically, one of the important challenges of the wet gangrene is it can lead to gas emboli form. They go to right ventricle and they can lead to obstruction and acute right ventricular failure, and the patient can die. So that's how the wet gangrene leads to the death. So what are you going to remember, doctor? Ham is an important source, and this is how typically a wet gangrene looks like. This is how a dry gangrene looks like, is what need to be remembered. Now comes the Clostridium tetani. Why do you want to remember? Tennis racket is the bullet you should not forget when it comes to tetany. And how does the tetany lead to development of tetanus? Very important question. Favorite question of examiner. Glycine is an inhibitory neurotransmitter in the spinal cord. So tetany goes and inhibits the release of this glycine. Inhibition of an inhibitor will lead to excitation. Minus into minus is equal to plus. And that excessive excitation will lead to the formation of tetanus. Rhesus sardonicus, you all know. Strychnine poisoning and tetanus look similar. So Clostridium tetani leads to tetanospasmin formation. This goes and inhibits the inhibitory transmitter, which is the glycine. And because of that, there is the muscle which goes into the tetanic spasm, is what you have to basically understand. So there are two tennis rackets in medicine, doctor. Please don't forget. Langerhans cell histiocytosis. You have the Birbeck granules, which are tennis racket shaped granules. Clostridium tetani, the gram-positive rod, is also tennis racket shaped, is what you need to remember for the NEETPG. Now quickly tell me 5 organisms leading to urease positive quickly. So shortly we are introducing in the U Medico. You can say, please remind me this point every day or every alternate day, or you can bookmark it so that the remaining is all not required. I know all of them. This point I think is something that I want to bookmark and revise, and you click. Automatically the app will help you. U Medico app will keep sending you notifications, reminders, everything. And also if you want, it will tell, hey, the friend of you who is also preparing in this topic, he has also bookmarked it. Do you like to see his bookmarks? You can, because he shared his bookmarks with you. That's how your preparation can go together, and that is the whole purpose. You know, it is not the coaching classes like us who actually bring you the seed doctor. Let me honestly tell you. कोचिंग क्लासेस इज लिटिल एंटरटेनमेंट. घर में बैठ बैठ के बोर हो जाते हैं, रीडिंग रूम में डल हो जाते हैं, इसलिए कोचिंग क्लास को जाते हैं जरा तमाशा देखने के लिए. इट इज यू एंड योर फ्रेंड्स सिटिंग इन ए टी स्टॉल outside the reading room. The discussions, challenges that you will have, they are the ones which ultimately help you to crack the entrance exam. Let me tell you, right? So today, the social feature in the learning app like UMedico will try to achieve that by bringing all of you together, helping you to read together. So urease, what are all the organisms where urease is positive? Proteus, Pseudomonas, Uroplasma, Nocardia, Cryptococcus. Like a parrot, you should rattle out in the tomorrow's exam. You all know rheumatic fever diagnosis. What are the criteria? SPEC, subcutaneous nodules, polyarthritis, erythema marginatum, and chorea. And at least 2 out of this SPEC must be there, and treatment is penicillin, as all of you know very well. Then comes the Corynebacterium diphtheria. 2-3 bullets which you have to remember for the exam. Chinese letters, Corynebacterium. You have to remember. Then how does the diphtheritic toxin basically function? It ribosylates the elongation factor 2, which is important for the protein synthesis, and that is how the toxin acts, is what you need to remember. It forms a gray membrane and you can't scrape it. That is another important differentiator of diphtheria versus other membrane forming organisms. It will wrap around the trachea, it will suffocate, it can lead to heart block, the Corynebacterium diphtheria, recurrent laryngeal nerve palsy can occur, and the pathogenic strain has a temperate bacteriophage, and we use elect test as a way for the Corynebacterium diphtheria. And how do you treat Corynebacterium diphtheria? We give antitoxin and then we'll give antibiotics. But let us quickly talk about what is elect test. But before that, 2-3 important stains frequently asked in the entrance exam about the Corynebacterium. Albert stain, Nisser stain, Pander stain, don't forget. They are present like V or L kind of a letter, that's called Chinese pattern. And this is an example, you can remember, this is how the Chinese letters, and this is where you need to imagine the Corynebacterium. And what is the mechanism of action of diphtheritic toxin? This is another important image you should remember. There is one A subunit, B subunit. A subunit will go and inactivate the elongation factor 2, and it prevents the protein synthesis by the ribosome, and that leads to the development of the cell death, is what you have to basically remember. Now this is called Elex test. Let us quickly talk about Elex. What you are seeing is elect positive, this is elect negative. So what do you do in elect test? You will be taking a paper which has got the antitoxin, and then you will be putting the suspected organism perpendicular to that. If at all that organism happen to be Corynebacteria, then toxin-antitoxin reaction will lead to the formation of the typical stripe precipitation reaction. So that is the elect test. So 2 points, bullets you should remember. Elect test, Corynebacterium, you should remember. What type of test? Precipitation test. What is happening? Toxin-antitoxin are interacting. These are the things you need to remember. So this is how the Elex test, where the toxigenic Corynebacterium diphtheriae is being detected. Now, what are the simple gram-negative organisms very commonly that we encounter? Our next review is going to be on the gram-negative, Haemophilus and E. coli. But continuing 4 to 5 more organisms in gram-positive, Listeria. What are the 4-5 points you have to remember for NEETPG? The only gram-positive organism, normally gram-positive organisms produce exotoxin. The only gram-positive organism that is capable of producing endotoxin. If you are first time hearing this now, then you have to be you have to get very serious, baby, with microbiology. But even if you listen now, first time doesn't matter. You remember it for the next 90 days and present in the exam hall. The only gram-positive organism which produce endotoxin, Listeria, you should remember. The only gram-negative produce endotoxin, but only gram-positive endotoxin is Listeria. It's comma-shaped, S-shaped or a gull-wing shaped. Comma-shaped, S-shaped or gull-wing shaped is what you need to remember. Tumbling motility, you should remember Listeria. Neonatal meningitis, abortions, you should remember Listeria. And adults, it can lead to heart block. And in the migrant workers, when they eat raw cabbage, that is another important source for the Listeria. The hot dogs that you eat in the pizza corner, Listeria. The chalk cheese in the pizzas that you try to eat, Listeria can come. Spoiled milk is something which lead to Listeria, whereas unspoiled milk is the source of transmission for Staph aureus. Another favorite question. Which is spoiled, which is non-spoiled. Then how do you treat? Macrolides and ampicillin is considered to be the management of choice. Now doctor, what is the meaning of tumbling motility? You know, have you seen a leaf slowly falling? Forrest Gump movie, have you seen that? Forrest Gump, excellent movie, right? If you have not seen Tom Hanks movie, tonight only you see that, available on Netflix everywhere, Forrest Gump, excellent movie. The tumbling motility, when the leaf is falling down, Listeria. Now, what are all the infections which can lead to heart block? Is one favorite question of the examiner. Diphtheria already you know, but you should also remember Chagas, Lyme disease, Legionella, and even Salmonella, typhoid fever also can lead to development of the heart block, is what you have to remember. Now, few comments on nocardia. Immunocompromised are the ones who are generally vulnerable to nocardia, and you can use trimethoprim sulfamethoxazole, or minocycline is another drug you should not forget, is very much used on the nocardia, is what you need to remember. Lastly, Propionibacterium acnes, it is also gram positive, it is anaerobe, and white comedone, black comedone, you all know very well. When will it become black comedone? Typically, if you pop a white comedone, oxidation reaction will lead to a black comedone. And sebaceous glands, propionic acid are the favorite area for the Propionibacterium acnes. And if progesterone is there, progesterone is a strong stimulant for the propionic acid production. Please don't forget. And it is anaerobe. It hates oxygen. Give enough oxygen to your skin, it will die. So, antibacterial washes, benzoyl peroxide, and abrasive scrubs, they are all the various options. You also give minocycline, and retinoic acid has got a role. But what are the side effects of retinoic acid? Once more, a favorite question of the examiner. Photosensitivity, hyperlipidemia, neural tube defects is another important thing you should remember about the retinoic acid therapy. Then finally, quickly tell me, what are all the bugs that you know which produce the IgA protease, is a favorite question of the examiner. Streptococcus pneumoniae, H. influenza, Neisseria. These are the three things you should remember when it comes to the IgA protease bugs. Then let us quickly summarize all the gyan we had about the gram-positive organisms. Let us run quickly. Before that, after that, we will go into the quiz session so that you don't feel bored continuously to listen me only. I like to listen from you also how good you are doing. But before that, let us quickly run through what all that we have learnt about gram-positive, which is the entire essence of bacteriology. Catalase positive, gram-positive cocci, if that is a question. Aureus epidermidis saprophyticus. Catalase negative, gram-positive cocci, what is your answer? Pyogenes, Agalactacea, pneumoniae, viridans and Enterococcus. Catalase negative, gram-positive, gamma hemolytic organism, what is your answer? Enterococcus. Close the eyes and remember the table and answer. Catalase negative, alpha hemolytic among gram-positive cocci, Streptococcal, pneumoniae, viridans and Enterococcus. Bilesculin positive, alpha hemolytic, gram-positive cocci, you will remember viridans and pneumoniae. Optocin sensitive is Streptococcus pneumoniae. Optocin resistant among the alpha hemolytic is viridans. Bacitracin is used for what? Differentiating beta hemolytic. So, bacitracin sensitive beta hemolytic is Pyogenes, bacitracin resistant beta hemolytic is Agalactacea. Then coagulase mannitol salt positivity is a feature of the Staphylococcus aureus. So, that brings us to the end of all that is needed about gram-positive organism. Gram-negative is not this tough. Gram-negative is more easy, only lactose fermenters, mannitol fermenters, all fermenters. Sharab peene wala organisms are all gram-negative, right? So that is all the story, doctor. Shall we quickly take up a quiz? Very good. I am very happy to see 193 is our 2020 score. I would like to see at least 1,000 students concurrently on the YouTube every evening. What a great academic orgasm that is, and a great beginning for all of us. Yes. So now you have to answer. Pick up your hands, punch on the keyboard, give me the answers, and I would like to see how good you are all preparing. Dr. Kiran Balani is asking, please share the table again, sir. Very simple. Go to Google. In the Google, you have Google Images. In the Google Images, just click and then say, type gram-positive classification. You will get full list of tables. One of that is the one which I presented to you. Very easy. Nowadays, knowledge is everywhere. On the Google, Beagle, everywhere it is there. Okay. Dheeraj, not only you missed, I too missed you in the yesterday's class, but don't miss. Next 90 days, I don't want to miss, right? Now, councilmen bodies. Punch your answer, doctor. Let's start the game. Very good. Hepatitis, chronic hepatitis B. Hepatitis B. Dheeraj Krishna is asking how to watch the missed videos fully, sir. Just give a call to the helpline and they will be helping you to get both the notes and videos. Yeah. 9000 868 8683 56. Okay. So this will be the helpline. They just WhatsApp it. Then they will direct you where you get this in the UMedico app and in the anatomy2medicine.com. Yes, councilmen bodies. Very good. Toxic or viral hepatitis, where those dead shrunken hepatocytes are called as councilmen bodies, which are eosinophilic globules in the liver. Tomorrow's entrance, NEETPG, councilmen bodies, histology picture is going to come. Paper out. Let me tell you, very common image based question in the entrance exam. Okay, doc? Right. Cowdrey type A bodies. Yes. Where do you find Cowdrey type A bodies? Please punch the question number and shoot your answer. So please shoot your answer. Also ask your friends to join the quiz time. I'm able to see 197. 3 more of your friends join, it become 200 viewers. I'll be very thankful to you. Yeah. What is your answer? Herpes. I'm listening. HSV. I'm listening. Smallpox. Coxsackie. Oh my goodness. Herpes. Easy to remember. Cowdery type A, HSV or varicella, internuclear eosinophilic droplet-like bodies. Once more, doctor, there is one dirty, disgusting list. Cowdery type A, Cowdery type B, what organisms lead to that? Oh, you need to remember, reproduce, and definitely a question is going to come. Okay. What you are seeing here is Bowman's capsule, which has got crescents. Can you please shoot me what is the most likely underlying cause for this Bowman's capsule may? Basically what is a crescent? A Bowman's capsule has a parietal epithelial cell and visceral layer, 2 layers. Parietal epithelial cells, when they proliferate excessively, then they form what are called crescents. Very good. Nitin Singh, Pranahit Reddy, Surya Prabha, Vikas and many more, they are all punching it as RPGN. Pathologists call it as crescentic glomerulonephritis, whereas the clinicians call it as rapidly progressive glomerulonephritis is what you need to remember. Now doctor, answer this question. Curran jelly sputum, where do you see? Curran jelly sputum. Some of the responses are coming as show or hide. I think you need to log in and if you are watching it, you can be able to use the chat, I think. Yeah, can you please punch? Very good. 200 again. Yeah, Klebsiella pneumonia. Excellent. Very common in alcoholics, elderly people, long-standing diabetes, and typically the bulging fissure sign. This is called as, here you have a minor fissure. Whenever there is a lobar pneumonia because of it, that lead to development of the bulging, and that is the nature of the Klebsiella, called bulging fissure sign. Curran jelly sputum, you should remember the Klebsiella. Now tell me, Kumar is asking, will these sessions be there for the next 90 days, sir? Why not, sir? I am otherwise jobless, sir. I have no other work. Next 90 days, if I can be on the side of you, where you won't be depressed at all, I won't let you to depress about exam or stress out about exam. I am also studying like a student. Every day, preparing the notes, preparing for the class. Almost 7-8 hours I prepare and come to this class. Don't think I'm extempore knowledge. It's like, though I had been teaching last 20 years, I'll be there without any other work to be along with you. Very good. Bronchial asthma, the choral mucus flux, you should remember. Now, what you are seeing here is a gross pathology of a depigmentation of the neurons of the substantia nigra. Substantia nigra. So, what is your diagnosis? What's your diagnosis for this? Yes. Should be the correct answer? Yes. Depigmentation of the neurons in substantia nigra. What is your diagnosis of this gross pathology? Excellent. Arshad Musa, Ankita, Carl, Kunjit Joshi, you're all right. Parkinsonism, rigidity, resting tremor, bradykinesia is considered to be the triad. Now, this is a very interesting question. Now, there is exophthalmos, lytic lesions in the skull, diabetes insipidus. This combination, what is your diagnosis? I know Jagrati, clean bowl, hyperparathyroidism. I thought that will be your wrong answer. I am waiting for that. Otherwise, Dheeraj also clean bowl, thinking multiple myeloma. Langerhans cell, Hand-Schuller Christian disease is a form of histiocytosis where you have this all combination. You should not forget. Now, what is this condition? Who causes this condition? I mean, what is the causative organism? Whenever there is a lesion like this because of the scratching of by the dog or a cat bite, shoot your answer. What is that organism which lead to these lesions? Pasteurella multilocida, Hensley, yes, Bartonella Hensley, Pasteurella multilocida, absolutely right. Now these are called the Donovani bodies. What is the organism leading to the formation of these so-called Donovani bodies? Shoot me a correct answer. Yes. Donovani bodies. Can you please shoot me the correct answer? Yes. I'm looking for a right answer. Leishmania. I'm getting a wrong answer. Lymphogranuloma venereum. I'm waiting for always the wrong answers. Right? Very good. Granuloma inguinale. Leishmania Donovani bodies is what you are able to see in granuloma inguinale. Now, this is called a typical lesion of erythema chronicum migrans. Tell me, what is this because of? What is the organism responsible for this chronicum migrans erythema? Guru Sharavanan is saying target lesion. Okay. Borrelia, Lyme disease. Excellent. Lyme disease. Now, this fat female 40 fertile has got a ultrasound abdomen done. You are able to see free fluid, thick wall, absence of echos, posterior to a caliculi shadowing. So, what is the condition that you expect in a fat female fertile 40? Easy question. Cholecystitis, gallstones, absolutely right. Now, what you are seeing is the ferruginous bodies, where iron coated bodies you are able to see, right? Now, my question to you is, what are they because of? What is the cause? Excellent. Arshad, Karel, Amer, Rito, Dipali, everyone is saying asbestosis, where the asbestosis fiber become coated with the iron is what need to be remembered. Now, my question to you is, this is called a Gons focus. In the pulmonary parenchyma, you have a lesion and you are also having a associated lymph node which is also positive. I know that you will all say tuberculosis. My question is it primary TB or a secondary or a post-primary TB to which the Gons focus is indication? I know it is TB, but what kind of TB? Very good, very good. Primary tuberculosis, where you are having on the chest X-ray a lesion and at the same time the regional lymph node, which is also hilar lymph node, which is being swollen, the combination called Gons. Now, this child is, when asked to get up, is getting up, first lifting his back, then taking the help of the floor, and he is getting up as such, he is climbing onto his own body. What is this maneuver called as? I mean, where do you see this maneuver? Excellent. Duchenne's muscular dystrophy. Now, this is called Heron end appearance on X-ray. So, where do you see this classically? Where there is an expansion of the diploid space, because the diploid space in the skull acts like a bone marrow for hematopoiesis. So, what is your answer? Excellent. In case of thalassemia, Prana Nitreddy, there are no exceptional answers for simple questions. Don't call it hyperparathyroidism. It is beta thalassemia. Beta thalassemia. Now, Typically above the diaphragm, you are finding an opacity which is called the Hampton's hump on X-ray. So Hampton's hump and a focal oligemic zone called Westermarck sign, they are the classical features in which condition? Very good. Pulmonary embolism. Carl is clean bowl. It is not pulmonary edema. Ankita is clean bowl. Pulmonary edema. Praveen Kumar is also clean bowl. I could correct 3 aspirants from falling down in the tomorrow's exam. It is not pulmonary edema, sir. Pulmonary embolism. Right? Oh, PE means pulmonary embolism. Okay, okay, I'm sorry. Pulmonary embolism, not edema. Okay. Now, these are called Herberden's nodules. Yesterday you have seen Bouchet's, right? So, this is the interphalangeal joint which is affected. So, where do you see Herberden's nodules? Please punch your answer. Ankita, Praveen, yes. Vikas is wrong. Vikas is absolutely wrong. Can you make it on? Off again. Just a moment, my screen is lost. Yeah. Yeah. I'm just waiting at least one student to answer it wrong. Where, yes. Right. Can you, yeah. When I said yeah, the screen was off. I should not be excited about your wrong answers. But thanks to all the guys who answered it as rheumatoid arthritis, I'm telling you, you are too late if you don't correct now. It is osteoarthritis. It is the dip swelling is Herbeden. Pip swelling is Bouchet, as already we discussed. Now what you are seeing here is the hemoglobin which is forming a hinge body. Where do you find hinge bodies classically? Come on. Should your answer, doc? Should your, I'm very happy, 194 watching. 6 more, call your friends. There will be 200. Very good, very good. G6PD. Suresh Prajapati is wrong. He thought sickle cell anemia. I will always have somebody to encourage me by giving wrong answers. So, refractile granules in the RBCs is G6PD. What you are seeing here is heterophile antibodies. Where if the heterophile antibody is there, that lead to development of clumping. Now, can you tell me, where do you find heterophile antibody? Classically, heterophile antibody test positivity, excellent. Hrudayananda, Sunil, Deepali, everyone is saying infectious mononucleosis caused by Epstein-Barr virus is the one which you need to remember. Now, this is a normal hemoglobin electrophoresis where you have HbA2, HbF, HbA. Whereas this is an abnormal pattern you are seeing where HbF has increased in its composition. Now, based on this electrophoresis pattern, what is your diagnosis? Where HbA has decreased and HbF has increased. So, what is your diagnosis? Based upon the lower image. Excellent. Thalassemia trait is something Nishat is trying. Excellent. Take a snap of this 200 watching. एक पिक ले लो अभी खुश हो गया Mogambo. I want this 200 to go to, oh, once more it gone to 198. That's good. Ask your friends to come and join. We will have a lot of fun next 90 days. Yeah. Thalassemia major. Very good. Very good. And on every Sunday, we have 12 to 3 discussion on all 300 questions of the mock test. So, please don't forget, you can join the mock test and take the mock test and participate and know every week where are you going wrong. I am going to give you those questions based on the analysis on the UMedico app. What are the questions frequently wrongly answered by a large scale of students? We will introduce some of them into the question paper every week. And Sunday morning, you have both on anatomy2medicine.com if you want a big web screen to answer, or on the UMedico app, you can have the mock test. And 12 to 3, we will have a discussion for the next 15 Sundays of the NEETPG. So you can call to 9000868 You can WhatsApp, and you can be able to um, uh, join in the mock test. Yes, very good. So next question. This patient is HLA-B27 positive, and you are finding these lesions on his feet, on the soles. Whoever answers it, no, oh, take my flying kiss. You will be the best guys. Behçet's Reuters. Behçet's Reuters. Come on. What is your correct answer? Let me check. Or is it psoriasis? Come on, come on, come on. Very good, very good. Reuters. Reuters. He can't pee. He can't see. He can't climb. Is the Reuters. He can't see. Uveitis. He can't pee because of urethritis. He can't climb because of arthritis. That is what you need to remember. Keratoderma blemorrhagicum is something that you should remember. Now my question to you, all of you, doctor, is HLA DR3 or DR4? Tell me the condition where it is implicated. Where is DR3, DR4 classically implicated in which condition? You all know HLA complex is on chromosome number 6, and those who have HLA, DR3, DR4, excellent. Siddhartha, Ritu, Arshad, Dipali, Mayank, Padma, everyone. Type 1 diabetes. Please don't forget. Type 1. Padma is clean bowled. Vishwa is clean bowled. With rheumatoid arthritis answer. Is rheumatoid arthritis also have any DR3, DR4? Please check that. But diabetes is the answer. Type 1 diabetes. Huh? Now, Homer writ rosettes. Excellent. 202. Please take another snap. 202. Yes. Homer writ rosettes. Where do you see them? Come on, quickly shoot your answer. Mayank is saying retinoblastoma. Right? Upendra Tiwari says retino. Yes, I am waiting for some wrong answers. Yes, yes, yes. Some of you are saying neuroblastoma. Neuroblastoma, Homer writ rosettes, right? So you should not do a mistake, right? Now, you are seeing a honeycomb liver, lung. It looks like a honeycomb lung on X-ray. Can you tell me, where do you see honeycomb lung? Classically, where do you see? Yes? Shoot your answer. Honeycomb lung. Where do you see? On X-ray. Bronchiectasis. Yes, bronchiectasis, you have got a typical ring-shaped shadows you will find. Interstitial lung disease. Yes. Indumukhi is our Swarnamukhi, who has rightly answered it as interstitial fibrosis, ILD, is the one which is the correct answer. Excellent, excellent. ARDS clean bowl, bronchiectasis clean bowl. Now you know what are the famous wrong answers. That is very important to know. Howell-Jolly bodies. Where do you see? What you are seeing here is the Howell-Jolly bodies. Abhi confirm karenge. Kisko kya rank dena, right? All your negativities in answering should get washed away in the next 90 days. Now tell me, doctor, Howell-Jolly bodies. Asplenia, splenectomy, postplenectomy. Come on. She Banu tried a new answer. Megaloblastic aa gaya beech mein se kahin se. So splenectomy. So you know what is the most common wrong answer? Megaloblastic is what examiner. Kunjit Joshi is also putting it as megaloblastic. That is what examiner would like to add into the options. Hyperphagia, hypersexuality, hyperorality, hyperdocility. These 4 hypers remind you of which condition and lesion in which area of the brain. Come on, shoot your answer. Excellent. Arshad Musa, Arsh Roy. Everyone is right. Kluver Busey, amygdala is the one which you need to remember. Any lesion of amygdala which is important in the limbic system will be responsible. Now, This patient is asthenic. Blood pressure is 80/60. He has got a significant hyperpigmentation which is present. And some areas of vitiligo is also there. Come on, tell me, what is your diagnosis based upon all this? Excellent. Bingi and Amir, Priya, Upendra, everyone is right. Hyperpigmentation of the skin is due to Edison. Remember, adrenal insufficiency in India, most common cause is tuberculosis. In India, adrenal insufficiency, most common cause in the West is typically the Edison. And Edison is an autoimmune destruction of adrenal. Please don't forget. Any adrenal insufficiency is not called Edison. Very important. Now, hypersegmented polymorphonuclear cells, where do you find them? Hypersegmented PMNs. I will be grateful and thankful to you if all 208 of you who are watching go to the Google Play Store on the UMedico. If you can be able to write a good comment about UMedico app, that will help the app to become popular and become more reachable to the people. So please don't forget to go and write your 2 cents of a good comment on App Store and on the Google Play Store of the UMedico app. That means a lot to us and helps us. Okay. Now, hypersegmented, very good. Megaloblastic anemia is the answer which is coming. Very good, very good. Vikas is saying MDS, myelodysplastic syndrome. Is it? No. So, macrocytic anemia, vitamin B12 deficiency, hypersegmented neutrophils. Now, doctor, the next question. Hypertension, hypokalemia is there in this patient. Considering this history, can you give your diagnosis? There is hypokalemia, hypertension, and the patient pick is being given to you. Right. Medical world is saying little. Oh, Indu, Crohn's, I didn't expect that. And Shah is saying Edison, I didn't expect that. And Bhatner, no. Upendra, no. Cushing, excellent. In Cushing, when high steroids are there, steroids lead to hypertension and there is a hypokalemia. That is the typical combination that you come across. Now, doctor, this is how a complete blood picture of a hypochromic microcytic anemia looks like. Now I am telling you it is hypochromic microcytic, but actual NEETPG exam में अगर ये slide दे दिए तो आप सेंट्रल एरिया में बहुत पेलॉर दिख रहे हैं ना, इसको देख के आपको समझ में आना चाहिए what is it, right? So hypochromatic microcytis. Very good. 216. I think tomorrow onwards we will touch 300 figure. That is the goal tomorrow. Yeah. Hypochromatic. Where do you see? Excellent. Iron deficiency. Then doctor, this child, alpha fetoprotein in amniotic fluid and the maternal serum got increased. So what is your typical diagnosis of this given situation? Excellent. Anencephaly. This is the girl with anencephaly. But Vandan taught it as something else. Yes. Anencephaly. It's not Downs. It's not Downs. Siddharth is wrong. Yes. Anencephaly, spina bifida, you find this combination. Now there is a hyperuricemia in this patient and he is being found to be biting his own fingers and many things. Self-mutilation. What is your diagnosis based on that story? Increased uric acid level. Excellent. Lesch-Nyhan syndrome, which is due to the hypoxanthine guanine phosphoribosyl transferase. HGPRT deficiency is what you have to basically remember. Very good. Very good. Now, this is a classical radiograph of an intussusception. There is a virus which is implicated in causing the intussusception. Can you tell me what is that virus that comes to your mind when we talk about intussusception? Shoot the answer, doc. Right? Rota, 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 rota. You all love rota just because it lead to what? Rota, rota, rota. Anything other than rota you don't want to think. Huh? Everyone say rota. Measles, measles. Yeah, yeah. Anything else? Come on. Epstein. Oh. Anything else? Okay, I'll give a clue. It is a lymphoid tissue which will proliferate excessively and that lead to development of a leading end of the intussusception. Now think of it. Yes? Adenovirus. It lead to excellent. No one said adeno. Alright. So adenovirus cause hyperplasia of the Peyer's patches and that become the leading end of the intussusception. So you are seeing JNV lesions and Osler's nodes. My question to you is, which is painful, which is not painful between the two? And where do you find these two? Right? Where do you find these two? Which is painful, which is not painful? Come on, shoot me the answer. Yes. Endocarditis, yes, I know that. Which is painful? Osler is painful, excellent. Painful os, you can remember, painful cervical os. So, Osler's nodes are painful, JNV are not painful, and JNV lesions are erythematous lesions. Osler's nodes are painful is what need to be remembered. Now, doc, what you are seeing, these erythematous lesions here, they are called Jerrich's Hexamere's reaction. So, where do you see Jerrich's Hexamere reaction? Excellent. I am listening secondary syphilis. Okay. You mean primary syphilis you don't find? I am listening Hrudayananda saying tertiary syphilis and somebody is saying leprosy treatment. Oh. Leprosy also can be a thought of some people. Okay. While treating primary syphilis, excellent. Over aggressive treatment of an asymptomatic patient typically leads to the Jerrich's Hexamere is what need to be remembered. Now, this is the classical lesion of the Kaposi, which you can see. Once more, Tom Hanks movie, I think it is Philadelphia. You can see a movie built on HIV Kaposi's patient. So, which virus is it, doctor? Come on, shoot it. Oh, Jagrati, you are very innocent. You are still with Epstein-Barr virus, but you should start thinking human herpes virus 8. If you answer wrong, no, you see how many people are crossing you and then trying to catch the seat, right? So, it is HHV 8. One more thing. Only homosexual HIVs will get Kaposi. IV drug abuse associated HIV may Kaposi nahi aata. That is another special feature about it. Now, this is the Kaiser-Fritzsche ring. You all know very well. Now, my question to you is, which layer of the cornea is the deposition happening? Copper is depositing in Kaiser-Fritzsche ring. Cornea has so many layers, right? So, which layer do you find the copper deposition? Excellent, excellent. Decimates. Somebody said endothelium. I am looking for a wrong answer. It is the decimates membrane is what need to be remembered. Don't forget. Endothelium will be the most common wrong answer. That's right. Now, these are called keratin pearls. Where do you see keratin pearls is my question to all of you. Should your answer, doctor? Keratin pearls. Yes. Yeah. You need to punch a little faster, Kushbu. Otherwise, you will be missing. Or question number you mentioned. Yeah, very good. Squamous cell carcinoma. Excellent. I am so happy. Kimmelstein's Wilson's nodules. You should not miss them histologically. Of course, examiner may not give all that. Only give this picture and ask you what is the underlying thing. Yeah. So, where do you find that, doctor? Excellent. Diabetic. Excellent. Everyone says diabetic. Now, what you are seeing here are the coilocytes. Coilocytes are typically a feature of the infection with which organism? Coilocytes. Yes. Question number 100. Yes. I am seeing it as HPV. Shivam is absolutely wrong, not Epstein-Barr virus. Yeah. So EBV can be the most common wrong answer. It is the human papilloma virus. What you are seeing is Koplik spots. They are the enanthem of which infection? The Koplik spots found on the first and second molar are an enanthem of which infection? Come on, doc. Yes, very good. Vikas and everybody is saying measles, which you should not forget. Recognize it if only picture is given in the tomorrow's exam. Now you are seeing a Kusumal's hyperapnea. You know, there are various ways of abnormal respiratory patterns like tachypnea, apnea, Biot's breathing and Cheyne-Stokes breathing or Kusumal's breathing. You should know one cause of each of these abnormal breathing patterns. Favorite question of the examiner. Yes, Kusumal. Everyone is saying decay. Yesterday already decay is over, no? Yes, very good. Decay, diabetic ketoacidosis, you find the deep breathing of the Kusumal. Now, this patient is having dislocation of the lens, aortic dissection and joint hyperflexibility. Which is that protein which is abnormal structurally in this patient? What is that protein that got affected in this patient? Yes, I know it is Marfan, but exactly what is the protein? Yesterday we discussed this. Yes, 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 very good, very good. Please take a snap. 234. I think I am enjoying nowadays. Looking at number of likes has become like an addiction for us, right? I am also liking to be liked by 234 viewers across India. Good, good. So, fibrillin 2 or 1 is the question. It is a fibrillin 1, please don't forget. Now, what you are seeing here are called Lewy bodies, doctor. Lewy bodies. So, where do you see Lewy bodies? Classically, in which condition? If you do biopsy, you will find Lewy body. The first wrong answer of Munisha was Algemia. Sumit Kumar said Algemia. So now you know what is the most common wrong answer of our classmates. That is very, very important. Even in coma, I wake you up also, you should say, hey, it's Parkinsonism, Lewy bodies, right? That's right. So Parkinsonism, Lewy bodies. Now, what you are seeing are called the lines of John, which you are able to see here. What are the pathognomonic of? Lines of John. Come on. Should your answer, doctor? Lines of John are pathognomonic of what? One loud answer. Antemortem clot. Okay. Is it a venous clot or an arterial clot? वो बताना है मुझे आप. Excellent. Ankita, clean bowl. Who is thinking venous emboli? No, baby. Then antemortem, okay, but arterial or venous? Shibanu is clean bowl. Whoever said venous, it is arterial. Please don't forget. Where the blood pressure is very high, that is the place where lines of John are formed. So don't forget. So where do you find these iris nodules called Lischke nodules? Quick answer, quick answer. Yes. Lischke nodules that you are seeing here, where do you see, doc? Excellent. Neurofibromatosis. Wonderful. Is it NF1 or NF2 is also important. So von Recklinghausen neurofibromatosis, you find them. Now, this patient has lucid interval. So I am giving you the picture also. Do you like to call this as a subarachnoid hemorrhage or subdural hematoma or epidural hematoma? Which one you find the lucid interval and what is this imaging diagnostic of? Prachi is saying, yeah, Ankita, everyone is saying, yay, because he's clean bowl. He says subdural hemorrhage. No, no, it is epidural hemorrhage. And whoever said subdural is clean bowl, somebody from China also is answering. I'm very happy to see. Yes, epidural hematoma is what you need to remember. Lumpy, bumpy appearance of the immunofluorescence deposits of the glomerulus. Where do you see them? Where do you see them? Give me one wonderful answer, doc. Lumpy, bumpy appearance of the immunofluorescence deposits on the glomerulus. What are the diagnostic of? Superbo, PSGN, Streptococcal glomerulonephritis. Shivam Sharma, clean bowl. MPGN, not membranoproliferative glomerulonephritis. Amyloidosis is Prachi's wrong answer. I'm happy to see that. Praveen Kumar's SLE is also a clean bowl. Yeah, it is PSGN. Lytic bone lesions on the X-ray are being found. Anemia is there, high ESR is there, bone pains are there, reversal of albinoglobulin ratio is there on the LFT. So what is the diagnosis of you, doctor? Right? When all these clues being given, it's a cakewalk, I know that. Everyone is saying multiple myeloma. Oh, Satish is still in that obsolete answer, hyperparathyroidism. No, no. That can't explain the high ESR and all that, doc. Now, Mallory bodies, also called Mallory-Denke bodies. Where do you find them? Mallory bodies, which you are seeing on the histopathology of the liver, they are diagnostic of which condition? Come on, should the answer? Yes. Asthma? No. Wilson? I'm seeing alcoholic hepatitis. Alcoholic hepatitis, absolutely right. Alcoholic liver disease. There's a large accumulation of eosinophilic material in damaged liver cells. So that brings us to the end of the today's evening, doctor. So the role of any preparation, the whole idea is, when will you win means you should have good companionship of 3 to 4 friends, right? Don't always look for the friends who are already in a very ripe stage of preparation. Any kind of friend, together you will discover the way how to discover the light at the end of the tunnel, right? By मैं भी भूल रहा हूँ, आप भी भूल जा रहे. How to remember the difference between a epidural hematoma and subdural hematoma? So how are we going to remember it? So like that, what is the difference between cauda equina and any other cause of the obstruction of the spinal cord? What are the differences? I am every time forgetting it. So for that, you require a good friend, at least 2 to 3 friends. That's the whole purpose. And it is a continuous motivation. You should not look back the valley and be afraid that, hooray, so much I wasted the time, only 3 months left over. That feeling should not come. That is the whole purpose. Every day, if you are in the middle of a community of about 1,000 students competing with some questions, every Sunday, if you are taking a mock test and having a discussion on the test and knowing where you are going wrong, and keep playing quizzes on the UMedico app so that it keeps telling you where you need to further improve. We are going to improve the artificial intelligence version of the app, and that's how dekhte 90 days is over, and you should come with a laddu packet and tell me, yes, I made it to the MD General Medicine and the General Surgery. That's the only dream that should be there in your heart. Tomorrow evening, once more at 6 p.m, let us all catch up. Thanks for coming. Yes.